so much, Suzanne, for being willing to come to do a PCBH Corner. Would you mind introducing yourself?
Certainly. So my name is Suzanne Daub, and I'm a licensed clinical social worker. I work right now for University of Pittsburgh Medical Center, and I work for the insurance division. So the little space that I'm in is an organization called Community Care Behavioral Health, and we are the largest behavioral health managed care organization in Pennsylvania.
Okay.
So we're not for profit, and we do all the Medicaid managed care. We
Okay.
have a carve-out state.
Fantastic. So, one of the things, people that are involved, and I think at CFHA and PCBH, the SIG, I think everybody knows you, but the one thing that we don't know is kind of what got you into primary care, what got you into primary care behavioral health. Do you mind expanding on that?
Not at all. So I love that. I love that story. So I had worked for probably 15 years in mental health and specialty mental health, and really, honestly, just got sick of it, and really wanted to leave mental health, ironically. And as a social worker, they think you have superpower and you can do anything.
Yeah.
So I got a job in a primary care setting in an FQHC as the director of social work.
Okay.
And I was very reluctant to take the job because I knew nothing about primary care.
Okay.
So knowing nothing is a great thing.
Yeah.
So I said, well, how do I learn when I know nothing? So I asked the primary care providers, do you mind if I just watch you work? Because I felt like that would be a way of, beginning to understand what was going on and be a good director. And I was stunned. So this is in 1994, right? And I was just stunned. I was like, oh my goodness, like, do you guys know that everybody that you see has a mental health problem, right? And they were like, oh yeah. I said, so what do you do? And they said, oh, we refer to community mental health. I said, oh, that's great. And they said, oh no, not great at all. I said, well, why not? And they said, nobody goes, and then even if they do go, we never hear back. And I said, really? So I started looking into it, and I got a HRSA grant to look at just the prevalence, because I wanted to, I didn't know if it was my lens, or if it was real.
Yeah.
So I got a HRSA grant. We did a PHQ-9, and we added some questions about trauma and substance abuse to it, and we did it for like a couple hundred people. And it turned out, roughly, this is again 1995 now, that 50% of the people walking through the door had depression, anxiety, 33% had PTSD. I mean, met criteria.
Wow.
So it really started me on this path of asking, what can we do about that? And it just completely coincidentally, I guess, or meant to be, coincided with CFHA's first meeting. So
it's interesting because it sounds like the way you describe it, again, kind of transitioning jobs, it sounds like this almost like rejuvenized you.
It totally did, and I would say it's when I became a clinical social worker. So I was trained as a clinical social worker, but from my point of view, what that meant was I was going to go out and be a clinician, a therapist, and that is what I did. And I kind of left the social work piece behind. And social work is really bigger than just seeing somebody in an office and doing therapy. But I really let that go and left that behind. And when I took this job, I suddenly felt like this is what it means to be a clinical social worker.
Awesome.
Yeah,
And
it's very
again,
cool.
as you tell the story, you can see that